Distribution VD simplified for memorization. What is VD? A theoretical measure of how a drug spreads throughout the body. Formula: VD, amount of drug in the body, plasma concentration. What affects VD? Liver and kidney disease can increase VD by altering protein binding. Implication for dialysis: low VD drugs, confined to the bloodstream, are easiest to remove by hemodialysis and drug locating. Low VDE stays in the intravascular space. Characteristics: large or charged molecules, highly protein bound. Medium D16E distributes in the extracellular fluid, ECF. Characteristics: small hydrophilic molecules. High VD distributes to all tissues, including fat. Characteristics: small lipophilic molecules, especially if tissue bound. USMLE style questions. Q1. What does a low VD indicate about a drug? A. The drug is highly lipophilic. B. The drug stays mainly in the bloodstream. C. The drug is stored extensively in fatty tissue. D. The drug readily enters the brain. E. The drug has low protein binding. Correct answer B. The drug stays mainly in the bloodstream. Explanation: a low VD means the drug is confined to the plasma and doesn't extensively enter tissue compartments. Why not the others? A, C, D equal characteristics of high VD drugs. E equals low protein binding, typically means wider distribution. Q2. Which drug characteristic is associated with a high VD? A, large, charged, and protein bound. B, small and lipophilic. C, confined to the vascular compartment. D, easily removed by dialysis. E, low tissue binding. Correct answer B, small and lipophilic. Explanation: high VD occurs when a drug can cross cell membranes and accumulate in fatty tissue. Why not the others? A equals low VD. C equals low VD. D equals opposite of high VD. Q3. Why are drugs with low VD ideal for hemodialysis? A. They have a long half-life. B. They are highly lipophilic. C. They remain in the bloodstream. D. They quickly penetrate fatty tissue. E. They have low protein binding. C. They remain in the bloodstream. Explanation: low VD means the drug is confined to the blood, making it readily removed by dialysis. Why not the others? A equals not relevant for dialysis efficacy. B, D equals high VD characteristics. E equals low protein binding allows tissue distribution, making it harder to remove. If you want